started. Welcome, everyone. Thank you for taking time out of your day to join us today. First thing on the agenda is Becca. She's going to talk about a couple of things here. Becca, I'll give you the floor.
Yep, I'm going to pass these out.
First of all, everybody sign in. Thank you.
Sorry, I don't mean to throw these at you. Just kind of quickly. Patsy, you're good.
I'm good.
We'll have a whole lot. So.
Sure.
Okay, so this is the Rapid Response Officer job description. It's already established job description, just kind of bringing this back. We did take it to second grade committee, who has forwarded on to resources. I will turn the floor over to Bonnie and or Shayna if you all have any additional comments of kind of where we are with this position.
Well, Shayna, if y'all have any questions with it, if they've already gone over this and been working on it for a few months on what they really need to fill this position and fill the role in the coroner's office for the rapid response. A lot of it it's taken down from a grade 19 down to a 16. It's all within the budget. And they removed really the bachelor's degree and added more for experience to suit their needs. I don't know if you have any other questions. It has been reviewed by the second grade committee. We made one little minor change, which is in there. And as far as I know, everyone agreed to move it to this committee, then to move it on into the description.
Okay, you want to add any comments that since this is falls in your department?
Well, like I said, we adjusted the job description somewhat. The pay grade was really the one we stepped down. It's basically the EOI would be 8,000. That's less than what the last position was. Just to kind of cover everything.
Can you all share some?
Yeah, those were quite alarming. Shayna, maybe share some.
So from January 1, which was when we had some changes in the office through July 1st, we've had 33 referrals in January, 55 in February, 19 in March, 8 in April, 18 in May, and 24 in the month of June. We've assisted 36 individuals with housing assistance, whether that's income-based housing applications, independent living referrals. We were able to help one with her first month's rent, and that person, she is in our program. We've helped 26 with transportation needs. We've repaired 3 vehicles, and this is through some of it's through our grant, our opioid grant money that we got early on in the year. We've given out 6 bikes. We've helped 23 with clothing, 10 with employment assistance. We've given out 9 female backpacks. We've given out a total of 65 fentanyl test strips. We've helped 81 with food nourishment. We've had 6 assisted with IDs. We've given out 18 male backpacks. 10 we've assisted with getting insurance, because for those to be able to get into rehab, you have to have insurance. So we've learned to navigate that to help those people that don't have insurance. We've given out 25 doses of naloxone, 26 sleeping bags. We've connected 6 veterans to veteran services, and we've handed out 31 xylazine.
What about those that have gone through treatment?
And we have connected in January 2. We've connected to treatment. 7 in February, 5 in March, 4 in April, 5 in May, 5 in June, and we have 3 that have completely completed their substance abuse program, 6-month program. We have that have graduated.
I would like to say the original one job description for this was for somebody to actually set up this department, this program from scratch. And now it's developed that's in place now. Now it's developed more a boots on the ground person.
Lisa, do you want to speak to the funding any?
Well, we just run some numbers before the meeting, and we may have to come back if the employee they choose, if they bring them in, because they can bring them up to 5. And then 2, if they choose family plan insurance, the county would have to fund more. So it just depends on who is chosen for this position, whether or not we'll have to adjust, because the opioid settlement is capped at 90,000 for this position and the need. So we may have to do some kind of budget change if they choose the higher insurance.
Going on the committee, have any comments, questions?
So you're saying if it comes in over the 90,000, then it would come out of would no longer be opioid funds, it'd be the county?
The difference would be out of the general.
The 90,000 is an annual. So when they start, health insurance also would start right away.
Retirement does.
Retirement would start right away, and so there's some ifs.
Yeah, we can run those numbers to see after.
So, did I have any, I don't think, any comment over here. Any magistrates have any questions or comments?
So what could be the total with the insurance and everything? Do you have any idea?
Worst case.
Worst case scenario?
We just roughly figured it before we came in here, and it was almost 92,000. But that is if they took family plan, which they may not. Yeah, and that's at a step 5. So
No, that's a step EOI.
That's
Step
the EOI.
5 is like
step 5 was
96.
like 96.
You remember we funded, or this court funded the original one with the $61,000 because that was when election was coming on. It's going to be capped. So that went away. So there's no intention. That's when we dropped it 2 grades and brought in the EOI. That would essentially be $8,000 under grade 19. Grade 19 was 58 at EOI, 58 times 68. And this would be at 50,000.
Any other questions?
I don't have a question, but I
You
just,
want to make some additional
Yeah.
comments?
I know we've always talked about this, and at the end of the day, what kind of price can you put on saving someone's life? And I think it goes to show they at least 3 that have completed, and they've been continuing this without a person there full time. And I can see it's unfair, but it's unfair for them to continue to take this on top of their current duties. So I think and we have some grant money that still needs to be spent. Roughly, I don't know the exact number, but the grant was 20-something thousand, 25, I believe. There's roughly 20,000 still that needs to be spent, and if we don't spend it, it goes bye-bye, it goes back.
Well, the thing of it is, the position is needed. The issue is not going to go away anytime soon. And like Karen said, they are having success with this program, and we owe it to the county to fill this position and to provide this service. So, are there any other questions? EG, is there a copy of this for EG? We're talking about.
for being late.
Oh, that's all right. All right. We're talking about the rapid response officer position at a pay grade of 16. Hopefully, putting that on the next full board agenda so that we can get moving on this position and get it filled?
One more thing. I just think this is important. When we first started this initially, there was some pushback from law enforcement from the different from our region in general, from the different departments. I know specifically of one. But ironically, since then, and since having other meetings and moving forward, EPD is now going to have a situational table. And if some of you may or may not be familiar, and I can let one of them speak to it, but I'll say it. But it'd basically be like this kind of table. All the different community partners come to it, and all representing different aspects of health. And so they'll bring up a situation, whether or not they don't mention names or anything until after the fact. They just say, hey, this person is experiencing this. They need this. We need we need help with X, Y, and Z. And then all those different departments or all those different entities help with whatever it may be. And the fact that it went from we don't want to participate to we're now holding these tables, they just show the need, the sincerity, and them trying to help. And the hospital is making referrals back to QRT. Um, they've had success from EMS now. I think the problem, from my experience, what I've seen and what I heard, the problem was just the openness of the job in the first place and the uncertainty of how it was set up. I think they've got it.
Patsy, if I can add, now, the resolution that I'm basing that 90,000 on was 2024-109 that capped that. Nothing says that court cannot go back with another resolution and say cap it at 95 to make sure that those funds go out of the opioid.
It's a good
one
point.
That can be a tweak.
Absolutely. So when Hardin County went through their Ready Recovery certification process, we're certified as a recovery ready community, which means that we scored high enough to get the certification. Doesn't mean we're perfect. And in the suggestions for future initiatives, this position was something that they recommended that we have in place in Hardin County, and we did that. So it was something that even in that certification process, along with the syringe exchange program, that out there. But they're both evidence-based strategies for dealing with opioid epidemics and overdose rates, and proven to help reduce those. So anyway, it's evidence-based. It means it's already been vetted and shows that it works. And it was something in a report that we received back from that certification that said that Hardin County needed it.
Did we have that position filled at the time?
No.
Okay. So
But you were in the works to
Okay.
do it, like it was in the works, and so then it happened right after
Yeah,
that.
right after that. Any other comments?
I just want to say I appreciate Shana and all the massive amount of work you have. I know it wasn't just you. There's a team. There's been others, but you've been leading it. So very impressive. Just want to publicly say it. Thank you for what you have been. Hopefully we can get this through here and get some help.
Oh, was great. She hung tough.
Yeah.
She stayed the course and made sure she saw it through.
True.
I do want to say, appreciate the board and consider this again, and I want to say this, they've been great committee. If you've never been to one of the graduations, I know a lot of the magistrates have community partner. If you've never been to one of the veterans graduations or the grad course, you need to go. It will absolutely touch you beyond measure, but just to see they tell their stories, and it's, as you know, corners off always have positive. It really does. It really, some of the stories really does.
It brings it all full circle. It sure does. So, hearing no objections, I'll make a notation that this will be placed on the fiscal court agenda then for the 28th of July. Sound good? All right. Thank you, Becca. And you got one more thing. Okay.
Okay, so this is a revision to the holiday policy that just went through. So the holiday policy that we put through was not intended to change any existing practices that we have within county government except for the EMS. And then we clarified just kind of how we're doing some existing practices. So we have lots of 24-hour services, as you all know, with some administrative staff. Once we kind of implemented this, we realized a tweak that needed to be made, which was, you can see that in the red there, that number 1. So basically establishing the holiday, putting that 12 a.m. to 12, midnight to midnight, is not in accordance with our timekeeping system. So the way that our timekeeping and schedules are made within 24-hour departments is where we had that adjustment. So that's why we put the wording in there to say that they will observe the holiday. The holiday shall begin at the beginning and the end according to the department's established workday as defined by our timekeeping system. So based off the timekeeping system, that's how our holiday is established. So, I mean, basically we're just trying to not make any changes to any other department. That's exactly how the existing practices are going, and we're just clarifying that here.
No changes actually are occurring. You're just eliminating confusion.
Clarifying how that should be defined. Yeah.
We had a lot of, I guess, questions about this.
Just with our 24-hour services, when we tried to clarify it, like I said, it's kind of hard sometimes when you're establishing EMS is a 24 hours, like they're here 24 hours a day versus some of our 24-hour services have different schedules. So that's kind of where the questions came in. And then
now you'll have it in writing.
Yeah, so we're basically not changing anything. We're just clarifying that.
Any comments on the committee?
The departments didn't want to change anything. They were like, we're not changing anything, right? And I'm like, no. So, yeah. Overall good.
This will be placed on the next report agenda for July 28th. All right. Do you have anything else, Becca?
No, that's it for me.
Thank you, ma'am. So, Aaron, I think you have a couple of items that you need to bring forth.
I appreciate that. Let me have time to speak. Our first item, I want to start at the top of my stack. First item is our Know Before Security Awareness Training renewal. It's a 1-year contract. We renew it every year. This year our price went up $2.49 per user. We have a quantity of 200 users, which is the bulk of the users that get trained in cybersecurity awareness. So it's just that's the only difference between last year's and this year's terms is the same. Everything's the same. It's just a rate change is being affected. So I would like to have this placed on the agenda so we can go ahead and make that renewal.
When does that contract expire?
August 5th.
Okay.
August 5th.
So the only change in the contract will be the increase of $2.49 per user at 200 users.
Yes, ma'am. Yes, ma'am. That's the only thing that has changed is a rate change.
Is it 249 or 204?
$2.49 from last year. Last year our price was $25.76 per user. This year is $28.25 per user. The difference of $2.49, $2.50.
Is it typically an annual
It's
contract?
an annual renewal.
Okay.
Yeah. This is based off of the subscription level that we're at. I did a lot of research and looked at going down one subscription level, but I think the services would be reduced if we went down subscription level. We've had several people that that several employees that are gone through the training, and then they end up failing some tests. So they go, and then they don't go back through it. And so we're starting to force them more and more. And that might be part of the rate increases because there's additional features to the program now to encourage users. Hey, look, this is only a 5-minute training. Do 5 minutes and move forward. The phishing tests are getting more complex. It's no longer the speeding ticket in front of the parking lot. It's, hey, look, this is an Amazon package. You may very well have an Amazon package coming, and or call this phone number, talk to our support. So they're getting very, very well, and that's indicative to the current state of malicious activity. Current state of malicious activity. Everyone's using AI. You go and even voice recognition. Use AI voice recognition, text to speech. It sounds like a person. It will give emphasis and emotion like a person, but it's AI generated. It's trying to get you to dial a number or click on an email. I'm going to send you an email. Click on the invite, and once you do, that's a malicious intent, so they can potentially invade our network, invade a computer, get personal, private data, health-related data, things of that. That's their game. Just what can they do to invade and cause chaos? So,
Do they typically raise that annually? I'm just curious.
yeah, there's an annual
They typically,
cost.
but do they typically increase
Oh,
that
yes,
annually?
yes.
Okay, so there's a pattern.
Yes, ma'am.
Okay.
Yes, ma'am.
Any questions? Anyone else have a question about this? Any magistrates have any concerns? I know it's needed. It's, I mean,
This was a
know,
budget item. This
yeah.
it's a every year occurrence, so it is a budget item.
There's no doubt.
This is KnowBe4 is one of the leaders in cybersecurity awareness training right now. There are others. We could very well potentially look at another program that is cheaper, but it wouldn't be as good.
Yeah.
The users would enjoy it. Wouldn't gas the training as much. We don't want to go back to the the cartoon characters talking about it as
Exactly.
power,
Yeah.
death by PowerPoint type deal, because that doesn't help it.
I know that the video clips are entertaining. It's almost like watching a soap opera.
Which you learn.
Yeah.
You learn.
I know. Yeah.
You learn.
So.
Each one of them makes you want to go to the next.
To the next one.
You know,
Yeah, they
it draws
lead you
you
in because they tell a story.
Mhm.
Like it's not just informative. It's got some a little bit of excitement.
Yeah,
It's
yeah.
a good-
And
it's
there's a
good
there's a
program.
series.
I'll get excited real easy.
I guess it must be maybe it's an age thing.
There's another series coming out. Hoping next month. It's more comic relief. So
Oh, okay.
so there might be a series of comic
Yeah.
relief.
Listen, I sat down and watched them like I was watching
I
like Criminal Minds or
Oh,
something.
I think they're. I mean,
binge worthy.
they keep my attention.
Oh, yes, they are.
All right, so we'll add this to the next
Yes,
fiscal court
please.
agenda on the 28th. Sorry. Okay, and you have
Going through my staying on cybersecurity awareness. There was an opening for the state Homeland Security grant program for 25-26. So they apparently it was defunded or deregulated or closed in 25. Nobody got funding, so they're doing a 25-26 this year. This grant is due on the July 31st. What I'm basing this project on is cybersecurity. I'm asking for approximately $26,000 in the grant to procure a software as a service for AI assisted email security program, threat protection, it's because it's AI assisted. It doesn't just look at malware type of indicators, things that it's seen before. It actually behavioral. So it looks at behavior. So if Magistrates and I converse back and forth with emails, and then all of a sudden, in the middle of the night, I get an email from one of the magistrates. Well, that's a compromised email because it doesn't normally come at that time. It may have a different subject, may have a different additional people as CC'd or as in the to front. It may have a different subject. All those things are behavioral. So it looks at it and says, hey, look, this isn't normal behavior. We're going to flag that. We're going to quarantine it and hold it, and then we'll review it later. Other things is it looks, because it's not definition scale. So it's not has a set of definitions. Look for these things. It's behavioral and it's AI assisted. It knows that, hey, look, there's 250 attacks overseas that are doing these type of modifications that's being reported. Well, AI knows that. AI tells it, hey, look for this type of attack, and then all of a sudden, hey, look, there's this type of attack. We'll block that type of attack without having to tell it or update definitions to security. So it does fill in the gaps for our security. It also falls under the national priority areas and state enduring needs, and the core capability in the FEMA's national preparation goals. So it meets all the check boxes per se for this grant. If we were awarded, this would be like, I want to say, the third time that cybersecurity got this grant. So it's very limited on cybersecurity things. So we get it with a cybersecurity emphasis. It's really something special because normally they don't give grant money out on this particular grant, even though they have it in there and they say, "Hey, look, work for it." They don't normally do it. They normally give it out for other needs. So
So
at
you
least
said
that's what it looks like in the
would be
past.
25, 26. That's
Yes,
what you, okay.
That's what it says. The 25, 26. 25 and 26.
Does that have the capability to also detect changes in like sentence structures and
It has
changes
a
like
lot.
grammatical,
Grammatical changes, grammatical errors
errors and that kind
aren't
of
as
thing?
predominant as anymore as they were. Before we could get an email, a phishing email, that the word, lawn is spelled wrong, or trash is spelled wrong, or there's sons or Hardin.
Mhm.
Yeah, there are all kinds of misspellings in it. Elizabethtown is usually another big one, longer words. Not so much. You run it through an AI generator, it comes out perfectly spelled. There is no graphical error.
Well, it'd be great if we could get that.
If we could get it, yes, ma'am. But it will fill in a gap in one of the core capabilities. It actually fills in more than one core capability from the FEMA's National Preparedness Goal. It fills in more than one gap. The main gap is cybersecurity, and it helps with the cybersecurity stack. And I know I'm talking a lot, and I apologize.
No, we want to know all
Most
about
people
it.
look at cybersecurity as in hackers and users. But our stack is 12, 15 layers. We got network security, service. We have network security. We have email security. We have workstation security. We have firewalls. The stack just goes on and on. So, but I would appreciate this being on
The 28th.
Yes, ma'am.
This
Please.
month. Any
Yes.
questions about this? It sounds great. I hope it works.
I hope it does too.
Granted.
And then the last thing I have is another software as a service, Brightworks 365 terms and agreement. I have copies of the terms and agreement for the Brightworks software as a service contract here. This again is a budgeted item. This was in this year's budget. The approximate cost, actually the total cost with 30 users and professional services, which is training, is included. It's $14,870. And what the software does for us is it's a project management software. So
This is something new. We've never had this software.
no, this is something new.
Project management software.
Yes, ma'am.
Okay, and what
Project management.
tell us what that is. What specific? Well, what main areas?
This help. We have a project management software now, but this is advanced. What we have. This gives us grant charts. It gives us more integration into our Office 365. Integrates with email, integrates with Excel, produces reports, basically grant charts. I mean, it helps managers, manage projects.
So are we dropping the other software?
Yes.
So that will save what?
I don't think it would save any money.
Oh, there's no.
Yeah, that's very, very limited with what we have now.
What we're
Very,
paying
very
now.
limited. Very, very limited. This will just take over.
But as far as cost goes,
There's no savings.
okay. No savings, but how
But
much
we
of an
get
increase?
we get additional resources. So we get training. We also get more integration into 365. Reporting is the biggest thing. We don't have much. We don't have probably any reporting now with the software that we're currently using.
You said this one is 15,000. What does the software do? You know?
It doesn't cost us a penny.
It's free.
We're picking up being able to report and do what?
Reports, grant charts, more communication, Excel, integration of PDFs. There's a lot.
How do we track our grants and stuff now?
Excel, as far as I know.
Grants, we have those in our same software that we have our contracts in.
Oh, asset target.
That's it.
Have it in there some, and there's the fiscal soft modules, but that not everybody has access to it. That's the problem. It's really a bunch of everybody's different Excel spreadsheets that are not consolidated. This consolidates online.
Some questions? Any specific questions from the about this particular agreement and what it's
No change in
will
terms.
provide? Is it a 1 year?
It's a 1 year. 1 year. There were terms. I did send terms through Jenny's office, and the only response I got back from Jenny's office is make sure that it was set for government because we're tax exempt. So, and then they went through it. We got a response back from the software vendor. I sent the response to Jenny's office, and Jenny's gave us okay.
Oh, so she has
Jenny's
reviewed
gave
it
us
and,
okay.
okay.
I would not have brought it unless I had Jenny's
That was
okay.
going to be my next
So,
question.
yeah,
Is if
Jenny's
she's
gave us okay.
looked at it. Okay.
There was one item in the terms that talked about taxes, and she questioned it. I got back from the software vendor. And it was just to cover them, saying, "Hey, look, if we're not tax exempt, then they're going to charge, expressive taxes on the purchase, but we are tax exempt."
Okay, but I did hear you say this is budget,
Yes, ma'am.
even though previously we were getting this service at no cost,
Yes,
right?
this is
You
budgeted
put this in
for
the
this
budget?
fiscal year. Yes, ma'am. Yes, ma'am. I put this line item in my budget.
Any other questions? We'll add this to the July 28th
Please and thank you.
court agenda for vote.
I appreciate
Okay.
it. Thank you. Thank you for your time.
Thank you. All right. Mike, do you have anything for us today?
Not right now. We are working on stuff that I'll probably be bringing to y'all, but not right yet.
Got a question for Mike.
Yes.
Tell me
Absolutely.
about the TNR, trap and release. How many do we do a year?
I'm making, I'm gonna guess and say it that I can get it real easy if you want me to get the actual, but I'm gonna say probably at least a 1,000 to 2,000, depending.
So the purpose is to trap the cat,
Well,
spay, neuter.
Yeah, but part of what we also, like if we can adopt some of them out, then we adopt them out. Because when we started the TNR, part of the problem or part of the complaints I was getting was, you're not doing anything about the outside cats. They're all coming back. So if we can adopt them out, if they'll use a litter box and all that stuff, then we're sending them through the adoption process and keeping them out of the outside.
That leads me to my next question. I received a call from Sergeant Kyle Woodward from the Radcliffe Police Department.
Yes, sir.
Are you familiar with the phone call he made?
A little bit.
And it was 33 cats in a house.
Yes.
He was told to open the window and let them go.
We were told they were feral. Feral means wild.
So even feral cats, we don't trap and stay. And
Prior to that, we did offer. We told him we could come. We could trap a couple at a time, but we told him there was no way we could trap all of them and get them all out of the house at that time.
Told me he was told to open the door and window, that y'all did not offer to come out there, and that he told you he respectfully declined to do that.
Well, I didn't speak with him, but
he respectfully declined that and then found an alternative.
Well, we are looking into ways to better help, which I'm sure you're probably aware of that too. But
I'm not.
We're looking into trying to do things a little bit different. I don't know what we would have done at that time because we had 80 in-house and 40 in foster.
Wouldn't we? Maybe you guys take the initiative to call around to some of your people that help y'all out. The other people. This officer had to do it.
Right.
You're animal control.
I guess you got a point on that.
So,
maybe so.
He opens the door, lets them out. I'm just doing rough math here because I did some information on it. If 17 of those were female, 17 in 1 year, you know what it turns out to? 912.
So, I'm looking into, I found out about it. I was there when the call was originally taken, and I know what was said on my side. I don't know what was said on the other side. I do know that we offered to trap some, and it was kind of like they wanted them all gone as soon as they could, and there was no way for me to have handled that. So
they didn't necessarily. The people they called, they shut the door, and it took them 2 days to trap them.
Okay.
So it wouldn't necessarily have to be done right then. But,
okay, well, that's the impression that we got.
But if we'd have went out there, maybe we'd have known more information.
Very good point.
All right.
I agree with
you. And Mike, what is our responsibility for cats?
Well, the county really, there is no law that says we have to do anything for cats in the state or in our ordinances.
If we're thinking that way, let's call it dog control, not animal control. I'm just saying to that point. I understand. I know what the KRS says, but I'm just saying we shouldn't be telling somebody to let the door open, let 30 cats out that were sick, by the way, that one of them died when they got to the rehab. Some other ones were sick. So we're just turning a bunch of cats out loose. So.
I wish we would have went and took a look. You're right on that.
Anybody else have anything for Mike? Thank you, Mike, for responding. Chris, for bringing that issue. All right. Judge Taul, do you have anything for us today?
No.
Oh. And so, Kenny Saltsman.
Yes. I just wanted to ask the judge. I'd like to better understand the purpose of the communication expectations that you sent to the department heads on June 25th. I've got it right here. I'm going to read it. It says, "Good afternoon. I need to establish a new communication expectation moving forward. If you or anyone within your department is approached by a magistrate requesting information or making a negative comment, please notify me the same day as promptly as possible. When responding to a magistrate by email or text, please copy both Bonnie and me on your reply. If you need assistance crafting a response, do not hesitate to reach out to us before replying. If the request or comment is made in person, please provide a summary of the conversation and email it to both Bonnie and me. Additionally, if fulfilling the request requires more than 10 minutes of your time, include the date and the amount of time spent in your report. This information is necessary so I can remain fully informed and prepared for any questions that may arise. Thank you for your cooperation and let me know of any questions or concerns. Judge Taul." So I'm just trying to see if you can explain what the problem was that you were trying to solve that led to that policy.
So is there some concern about the policy? Do you have a concern that something has happened? Brought this up?
Yeah, that's why I'm asking you. What brought this up?
I'm asking you, why are you bringing it?
Why am I bringing it up?
Yeah.
Okay.
I mean, has something changed or something that concerns you about your ability to communicate?
So why is it necessary for employees to report when a magistrate requests information?
I'm just asking you, why is this a problem?
Okay.
If this is a
What-
policy that
let
I
me
want
ask
to
you
put in
this.
place.
Okay, go
then,
ahead.
Okay.
Go ahead, finish.
If
I'm
this
sorry.
If this is a policy I want to put in place with folks that work, has this caused an issue?
All right, but let me ask you this one. Why does the email single out negative comments by magistrates? Why is that something employees are expected to report?
Has that been a problem?
Okay. What concern led you to require employees to copy you and Bonnie directly on every email or text response by a magistrate?
Did it not say at the bottom what the reasoning was?
Okay, so you wanted to stay informed? This information is necessary so I can remain fully informed and prepared, okay? So I understand wanting to stay informed, but my concern is whether this policy creates a perception that employees are being asked to report on elected magistrates, and whether that can make staff hesitant to communicate openly with members of fiscal court. So how would you address that concern?
First, I've heard that it is a concern.
Okay, so now you've heard it, so how do you address that concern?
I haven't had time to think.
Okay. So you just implemented this whole policy without thinking it through how others would feel, you just sent this to the employees. You didn't let any of the magistrates know that this was a new policy.
I think it was necessary.
Not necessary, but it includes, it's affecting magistrates, correct?
Is it?
That's what I'm asking you. I mean,
think so.
you're telling them
I don't think it
that not
affects
to
you.
do anything.
I didn't. No. What?
Not to do anything unless you know about it.
No, I didn't say that.
Okay, but let me ask you this. What's the 10-minute deal on it?
What's the 10-minute?
Yeah. They have to, let me find it again.
I think it was if it takes more than 10
If the request or comment made in person, okay, additionally, if fulfilling the request requires more than 10 minutes of your time, include the date and the amount of time spent in your report. Are you gonna have us to reimburse them for their time? Is that, I mean, I don't understand.
That's kind of a silly comment.
Okay, what's a silly comment?
That you reimburse them.
Okay, so then why do you need to know if it takes more than 10 minutes of their
I
time?
mean, I have responsibility for what the employees are doing, and if they are being asked to provide information that takes quite a bit of time, then I'd like to know about it. And we can talk about it and see if there's something we need to do to speed up the reporting process or whatever it might be. I mean, our people are busy. I mean, they're doing their jobs. So if they are getting asked for information that's going to take them, if it's not just a typical report or something that they can easily answer, it's going to take quite a bit of time to do that. I want to know. It's just as simple as that.
Okay, so you want to know if we're doing our job by talking with the department heads. If it happens to take more than 10 minutes, you want to know that for sure.
I would like to know, yes.
Although, even though we're doing our job.
Nothing in there that you read keeps them from providing information to you.
I just wanted to get a clarification.
Yeah. Well, there you go. You
I
got
mean, I wasn't the only one that was curious about it.
Well,
I'm not the only magistrate that wanted to know.
okay. Well, it's the first time that I've heard there was an issue.
Well,
So
this is the
it
first
has-
opportunity that I've had to
well, you
discuss
haven't
it with
you
you.
haven't
Okay,
called
here.
me, have you?
No, I haven't.
Let me just kind of get in the middle of this. I think probably what Kenny trying to convey and through his questioning and maybe some of the other magistrates too, because we are aware, I think most of us are aware of this email, is maybe the issue of infringing on maybe what we feel like that we could do to reach out to a department head if we had a question. And now this might make us feel like, well, gosh, maybe that's not acceptable. Or maybe we might be getting that department head in some kind of a negative position by taking up too much of their time. And I'll just use myself as an example. I reach out to department heads from time to time, especially the road department,
Understand.
because I have constituents that need my help, and I'll call the road department. So now that that's being reported, you need to be, in the loop on that. It makes me feel as though I'm infringing on their time and their resources and their professionalism. And I shouldn't feel that way. I should be able to feel like, oh, I can call the road department supervisor or send an email to the road department supervisor at any time if I need help in something. So I think what this is, what Kenny is saying is it makes us feel as though we're not part of the team, that we're like an outsider here, and we can't cross over this line to reach out and communicate with the department staff.
Okay.
I think that's the issue.
I got you. Yeah, I think you're reading between the lines too much. I think I put the reason why I needed to know, be informed, more than what I have been in the past. So that's all it is. There's nothing in here that keeps any of our staff from communicating or providing feedback to any magistrate.
But that's good to know. But I will say, typically protocol is that when you send out correspondence and you're mentioning a certain individual or magistrate in general, that you would copy that person or that group of people on that correspondence, or in this case on that email. And we were not copied on that correspondence. We were left out of that communication. So now we're having to interpret what it meant and what the intention was. I think maybe that also caused an issue.
I see.
Is that we weren't included in that communication. So
That's what raised my suspicion.
I mean, it really wasn't meant for your eyes. It was,
That right there.
Yeah.
it was
We know
an
that.
internal communication for them to do something a little different than what they had.
Do you remember that hashtag Team Hardin? I'm just wondering where that's at. That's my only question. There's no team here.
I think you're reading between the lines. That's all there is to it.
I will say, Judge, I've seen a marked difference in my conversations with the department heads. Not all of them, but a lot of them are kind of real cautious about what they say and what information if I ask. And I'll just cut to the chase on this. I believe I was trying to prepare for the town hall meeting because we felt like it was going to be a lot of information asked of us about the fire services. That's now one of our big issues. And so I got a hold of emergency manager Joey and asked him for just copies of the budgets that should have been on file. And he told me I'll have them by a certain time. Nothing happened. So I followed up with him. And the next thing I know, I was getting information from your administration that you would get that information to me. So I'm pretty sure that that's probably what triggered all this because for some reason, I guess it took a lot of time to copy 12 budgets from 12 volunteer firemen that we've had in our records, supposedly had in our records. And I come to find out that we didn't have all of them. And as far as, and you corrected me on one, I called it training records. It was actually testing records. Out of the 12 departments that responded, I only had records from one that had their test. And there was some documentation stuff in there on who was compliant, who was not compliant. So I don't know, but ever since then, I don't know if that's what triggered your response, your email. It was right after that. I was just trying to get prepared for the town hall meeting to do my due diligence, is what elected officials are supposed to be doing. And it's driven a wedge between. If that's what your intent was to drive a wedge, it's worked in a lot of departments.
Well, the intent wasn't to. My point, that particular example, I actually found out some stuff that I didn't. So, so it's, there's good questions that are posed, and there's information that's being passed back and forth. And if I don't know what that is, then I don't know that there's a problem. Then this is another opportunity for me to get that information.
Do you think that obviously, if I'm not mistaken, that email was classified confidential, right?
Yes, it was.
And if you had 10 department heads and you send it to 9, you leave out one, and that one person finds out, do you not think that that's going to cause some division between that 1 and 9? I mean, there's always going to be division whenever you start excluding people, and if you mark something confidential, it takes 5 seconds for us to recognize the message. Right. So at the end of the day, you say like, yeah, you learned something good and beneficial. That's fine, but I think what Patsy's point was is, had you had sent that to everybody, including us, probably wouldn't have been like trying to exclude us, but the way it was presented, the way it's been gone about, and it's just also time, right? You kind of start looking at the scope of what's 3.5 years in. All of a sudden, now this is the new communication model. Just seems a little like you are driving a little bit of a wedge. So for me, from my perspective, if I'm onto something, or I see something, or I want to hear, or I want to know something, and I don't necessarily feel like I have to tell you, right? That's my job, because we're all equal members of fiscal court. It's not Judge Taul's administration and of fiscal court, and that's it. Like, we get to make the decision, just let you.
I'm not sure about that.
You have 1/9 vote. I'm 1/9.
I'm not talking about a vote.
Well, that's what I'm saying. Like our information that we're gathering, our fact line, comes from that, right? So
it's not coming from me.
Yeah. So
That's true.
if we find facts, and it's something that we're interested in, it may have absolutely nothing to do with a vote or whatever it may be. And so at that point, I feel like you're wasting employees' time by making them tell you and go through all that. But I kind of see it as counterproductive in a sense, just because you want to be in the know for whatever reason 3.5 years into it. So I think ultimately, for me, from my perspective, working together, like Chris said, the team aspect should have included us. Probably would have been a better option to show us.
Well,
I understand.
and there's also the relationship building aspect of this. I felt like, I'm only going to speak for myself, okay? But I feel like I've built a really good relationship with each department head and their staff. And I feel like that they're comfortable talking with me, helping me, and I feel good about reaching out to them for certain things that I need that are county related, are legitimate. And now I feel hesitant because they're going to have to report to you, and they're going to have to add you to an email that I didn't initiate. Let's say I initiate an email. I sent that to, let's say Stephanie, but I didn't add you. She'll have to add you to that email conversation because now, and I don't know. It just seems like that our relationship may be, I guess, hindered in some way. Maybe she doesn't feel as easy talking with me, and I'm just using that as an example. But I think there's more aspects to this new policy than meets the eye, or that what you first realized, because we were left out of the loop, and maybe we just feel like we're being left out of the team, not on the team. Sometimes I feel that way. That I'm not on this, that we're not on the
I
same
feel that way
team.
too.
But I try to do things that mesh us together and bring us together. But that sending out correspondence where you don't copy people and let people know things, that is an intentional.
That was just a simply an internal communication, and it did not change anything that you have concerns about. Still get the information that you want. The difference is that I can know about it, and it's not. It's thinking too much through this. Putting, I don't know. It's like putting additional stuff in here that I had no intention of doing, and I'm sorry that it came out that way. Now you know what it is. Nobody came to me personally and asked me about it, so this is the first time that I've heard that you guys knew about it. First time I've heard that you guys had concerns about it, or any one of. I'm throwing everybody in there, but any of you that had a concern. I felt like you should have gone ahead and called me and said, why did you do this?
Well, I think the word transparency, I know you are big on transparency,
I am.
and so am I. And I think we all are big on transparency. But that word comes to mind when I think about this whole exclusion thing of the magistrates not being informed. And I think that's transparency was not met. I think it could have been informed. I don't want to,
Okay.
talk the rest of the day on it, but if anyone else wants to chime in, I think it is important, though, that we express our feelings about this, and just the fact that we felt like that we should have been included in firsthand to know that this policy was set in motion.
Judge, I think, kind of early on, you had asked us all to kind of go through you for daily things, and I feel like I've done a pretty good job at going through you, including conversations with the mayor or different things. I know Fred and I met with him about a grant, invited you, tried to stay in the loop. It does feel like a little bit of a stab in the back when it's like, hey, I can be transparent and tell you about these meetings and invite you, but you can't return the favor. And I think at the end of the day, just the communication goes a long way. Just communicate with us. If you want us to do that, instead of just telling them in a confidential email, it should have been, hey, moving forward, I'd like to know things that are going on, and the approach would have been a lot different. I think intent is 90% of it, but it's execution. Is the 10%. That 10% will. So moving forward, if it does have to do with us, I think it'd be rightful for us to know up front. Just like you asked us to let you know if we have situations.
Right. Thank you for the feedback.
I think conversations like this can be healthy if used and presented in a positive manner, and bring us all together a little bit closer. We can move forward now from this, and that's what we need to keep in mind. Let's move forward from here. Thank you for addressing that. Okay, Laurel, you're next.
So I just briefly want to share that we have added a new digital service to the library Canopy. It is a free video streaming service for our library card holders. So instead of paying for a subscription, you can use your library card and you can watch TV shows and movies and things of that nature. Just showing you the value of what your library card gives you in this community.
So that was one of your goals, right?
It was. It was.
Congratulations.
Typically, something like this is extremely expensive, and we would never ever be able to afford it. But after some deep research and going with a slightly different package, we're able to provide this for our patrons. So very excited.
Great.
So please sign up. All you have to do is create an account, and you can watch all kinds of wonderful things.
Awesome.
I'll share.
Hey, me too.
Yeah.
I'm just sending it out to everybody digitally.
Here's the good news.
I will.
But she has it digitally.
No, I'll give you that. Give it to you. Thank you.
Okay. Corey, have anything else? This is great. This is great news. Thank you so much. And Sarah?
Just a couple of things that I wanted to get out. We're having our back to school bashes. We had one scheduled for tomorrow night or tomorrow evening, and the weather, so we've changed that date. We're obviously giving immunizations to get kids ready for school, but even if the kiddos don't need vaccines, we also will have dental varnishing there. We'll have all of our programs out. So environmental will be there talking about how to prevent mosquito bites. Like there's all kinds of information. So you'll get to see all of our departments. There's games and activities and prizes and things like that. So just encourage you guys to have people come out. So it's rescheduled now for July 29th. So I brought one of those if anybody wants to help us promote that. And then the other cool thing that we're doing, and this was Representative Bratcher made this connection, but there's a program called Kentucky Hears through the Hauser Hearing Institute. And they go into communities and can provide some services, including screening and access to audiologists, help with hearing aids, that kind of thing, troubleshooting with hearing aids. And they can bill insurances, but sometimes the deductibles are really high or people don't have insurance that covers this. They have funding that they get through the General Assembly to help backfill that. So it opens up that service to individuals. So what they're doing now is they're coming to, we're hosting them at our Hardin County Health Department location. People from other counties can come in and get the service. So I'll start that one this way. But anyway, they come quarterly, but you have access through telehealth and some other things to audiologists if you need them to troubleshoot. We had our first clinic last Friday, and we did have 9 patients come through, which is pretty good for a first time. Our next clinic is October 16th, and then January 14th is the one after that. They're from 8:30 to 2, and there's a 1-800 number under that to call and make an appointment. So if you know anybody that could use that assistance. There's so much to hearing and how it affects your employment, how it affects us as we age. People with a history of opioid use are at high risk for losing their hearing, which also can hinder recovery and staying employed and job interviews and school achievements and everything else that are linked to that. So it really is kind of a base thing that people need to be successful in life. And so anyway, we're happy to be able to provide the opportunity for people to come and get the service at our clinic. So that's at the 580 Westport Road clinic. So if you'll just help us promote that too.
Thank you. Because you're always doing something good, always coming with new programs and yeah,
Right.
awesome. Absolutely. Thank you.
You should email that to Becca.
$100.
All right, that takes care of our agenda. Is there any last minute items that bring up? None? Meeting adjourned. Thank you for coming out and joining.